Good morning and welcome to Shriners Hospitals for Children in St. Louis. My name is Tammy Robbins and I am actually broadcasting from my home for the sake of social distancing purposes. And I'm here today with Dr. Scott Luhmann, who is Chief of Staff at Shriners Hospitals for Children and Professor of Orthopedic Surgery at Washington University School of Medicine. Welcome, Dr. Luhmann.
Good morning and hello, everybody.
We'd like to welcome our Facebook fans from St. Louis and the metro area and around the Midwest and really around the world. We're glad you're joining us today to learn more about Shriners Hospital in St. Louis and how we are keeping our patients and families safe from COVID-19 while continuing to offer our world-class care in pediatric orthopedics. But first, I think we'd like to learn a little bit more about you, Dr. Luhmann. You specialize in spine conditions like scoliosis, is that correct?
That is correct. As you mentioned, I'm a professor at Washington University where I did my orthopedic training and I did 2 fellowships, one in pediatric orthopedics, another one in spine surgery. My elective practice is 100% centered on pediatric and adolescent spine problems, mainly spinal deformity. That's what we do in more in orthopedics, and such as scoliosis and kyphosis. And, I take care of all kids from 0 to their early 20s. And we have every type of spinal deformity. In addition, myself, in addition to my great spine partners and pediatric partners, provide the most advanced and cutting edge surgeries such as the Schiller procedure, vertebral body tethering, we do magic rods, ApiFix, vertebral column resections, etc. So we really provide very comprehensive care here at the hospital for children and adolescents with spinal problems.
That sounds like the very latest in technology, on the cutting edge, leading the world. Am I right about that?
Absolutely.
Great. Well, it's great to hear what it is that you do at Shriners Hospitals, but I'd like to, before we get into the meat of things that we're talking about today, I'd like to ask you a little bit more of a fun question. All of us who are part of Shriners Hospitals for Children have a special place in our hearts for it. And tell us a little bit about why Shriners Hospital is a special place for you and why you've chosen to practice here.
Well, as I mentioned, I trained here at Washington University, and that's part of the campus. I've been part of Shriners for over 25 years in varying training roles, and I've been an attending for the last 20 years. Pretty much I know its mission and its culture extremely well. And, what most of us say is that when you walk through the front door of the hospital, you immediately sense a difference in this place. I mean, it's truly a hospital that's dedicated to children, their musculoskeletal problems, and it has that aura of holistic, patient-centered medicine that we all strive for in our practices wherever we are. But this hospital truly embodies that. We take care of kids and families regardless of their insurance or lack thereof, or their ability to pay. And so it creates this very warm, family-centered environment. Our families get very connected with us and our nurses and et cetera. So it's a wonderful place. It's a great team care that we provide here at the hospital.
So really, people could choose to come to Shriners Hospitals, even if they have insurance, and they should choose it because they have insurance, because of the holistic and wonderful feelings that we provide and the great care that we provide. So that's just a wonderful to hear it from the physician's perspective of what makes us special.
Absolutely. We work at several hospitals, and I'll tell you that when we walk through the doors here, it's amazing how it just feels different than other places we work in. It's hard to explain. It's just that aura.
It's that feeling. I have to tell you that, during the past few months during the COVID pandemic, I have been working from home. So I haven't had the opportunity to go into any of our Shriners hospitals. And I have missed that feeling. I came into our facility once because I had a problem with my laptop. And the love that I felt immediately when I came in the door and get my temperature checked, I was like, oh, I just, seeing our people and the love that you feel when you come in, it's different.
Yes, I completely agree.
Okay, I'm going to put my glasses on to make sure I get these questions correct. So we want to make sure that we are asking some of the questions that our patients and families want to know. And the people who support us want to know about how we are adapting our care to keep everyone safe during the COVID-19 pandemic. All of these questions were submitted by parents of our patients and our followers on Facebook. So we want to thank all of you who submitted questions for Dr. Luhmann. Dr. Luhmann, a mom in St. Charles has asked us a two-part question. My child has an appointment soon. How safe is the hospital? And second, what changes have been made to keep everyone protected from the virus?
Great question, and that's a very pertinent one, and one we're worried about wherever we go, whether it's the grocery store, the hardware store, or wherever. People can be very intimidated by a hospital because obviously some hospitals have COVID positive patients. But the health and safety of our patients' families are our top priority. We're really ready for people at this point. We have started back up our clinic and outpatient surgical and inpatient surgical services about a month ago. And, we understand that people have anxiety about bringing their kids to the clinic for an appointment. But we developed a process and plans here and have implemented them in accordance with the Center for Disease Control, the Department of Health guidelines here in the state of Missouri to keep everyone in our hospitals safe. When you come, you'll get screened, the usual questions that you've heard for COVID screening. And then we ask people wearing masks. If you don't have a mask, we have masks for you to wear in the hospital. And we practice social distancing here at the hospital. So, we're very comfortable with our plans and how we can minimize the risk to individuals coming into our hospital. Again, we don't have any inpatient COVID patients. We never have. If anyone tests positive, even if an employee or a doctor has to feel sick, they go get tested. So we really have the highest standards of trying to minimize risk for ourselves, our families, and our patients as much as we possibly can.
You might say Shriners Hospital may be one of the safer places to be.
Well, I'll tell you, Tammy, I feel more comfortable being here than I do, as I said, going to the hardware store, the grocery store, or getting gas in my car. I'm very comfortable here because everyone's practicing. They have masks, except for which is my office right now, closed. But social distancing, washing hands, being very diligent and thoughtful of others is a big part of why this is such a safe place to come.
It's baked into our culture.
Yes.
A mom of a patient in Columbia, Missouri asks us, do I need to be tested for COVID-19 prior to coming to the hospital?
For an outpatient clinic visit, the answer is no. We will do just what I mentioned, which is you'll be screened at the front door. They'll take your temperature, and then they'll ask you to wear a mask while you're here. When you come into the waiting area, we've created areas of the hospital within the waiting area to keep families separate from other families. We have cut back the volume of our actual seeing patients physically in the hospital, so we've tried to time them out so we don't have huge packed waiting rooms, which has happened in the past, but we're trying to make sure we keep people separate. We try to have just one parent come in with the child to the room, just trying to minimize bringing entire families in, et cetera. And we've actually done quite a few things to minimize that risk. But the only people that really get tested for us are those who are going to be coming in for surgery. Obvious risk. We have the young people get tested about 48 to 72 hours beforehand. We can test them here through the hospital, or people can test locally. That way, when the people are here and they're undergoing surgery, and anesthesiologists and nurses in the OR are more exposed to what they have in their oropharynx, their mouth, and their lungs. It's a safety issue, so to minimize spread amongst everybody. And then they come to the hospital and spend time in the hospital. We don't want them getting other people in the hospital infected. So we do screen that way also. But just for an outpatient visit, the answer is no. And this is a really good opportunity, too, to talk about the other thing we're doing, which is more virtual visits.
Thank you. I was going to ask you about that. Yes.
Yeah, that's becoming the new way that we're approaching a lot of this. At this hospital, is that we are reaching out to families through this kind of a platform where we can see people, we can talk to them, we can have them send us radiographs, x-rays if necessary to review. And that way people can stay home And that's a big deal, when not just from the interaction of minimizing risk for coronavirus, but it's also convenience. We have a very large geographic catchment area here, from Oklahoma and Kansas to Indiana, Tennessee, Iowa. We have driving 8 hours to come see us for a doctor visit. And if we can start the care or incorporate telehealth, this virtual visit, into that, that saves families an incredible amount of time, energy, and money to stay home. They can sit in their family room with a tablet, laptop, and they can interface with us. And that way they don't have to miss work, don't take the child out of school potentially. Obviously, no school now, but when school starts back up again. And it makes it a lot more doable for families. And it's been a very nice way to do it. Families have loved it when we've done that. They go, geez, we're done. I can go do everything else in my life instead of driving all the way to St. Louis and driving all the way back. And the answer is yes. This is the way we do it. So it's really been a nice addition for the way we can take care of kids and families.
And I'm told that even some of our physical therapy appointments and occupational therapy appointments have been taking place in that way as well.
Yes, absolutely. And that's a great way to connect with our therapists. There's lots of families pre and post surgery or no surgery at all are able to interface with our therapists to go over, how the child's doing, how the range of motion is, what difficulties they're encountering, whether they're doing the therapy by themselves at their house, or they're going to a local therapist. They can interface with our really, we have some phenomenal pediatric occupational and physical therapists who can really help. And what that can do too is, the local therapists often are not experts in some of these very unusual and infrequently encountered problems. So our therapists can help their therapist often get the patient to that right place, because they can't physically be with them all the time, but can really provide that link to providing the best care possible.
This is, an important development, I think, for Shriners Hospitals for Children, because of the high level of expertise in the very specific specialties that our folks have that
Right.
People may not have access to in their hometown. They can get it through us, and but also not have to travel so far in order to do it. I think this is amazing.
Totally agree. I mean, that's our strength, is the fact that we take care of some of the most unusual, exotic problems, but also very common day-to-day problems also. So we really are kind of a one-stop shop, so to speak. We have, and not just myself, but we have a whole group of extremely experienced therapists, surgeons that are phenomenal.
Great. I had a few more questions here. I'm going to ask, I think, about face masks. Can a patient and caregiver be given a face mask for time spent with a doctor and other medical professionals if they don't have their own?
Yes, absolutely. We have them right there at the front. When you come in the front of the hospital, everybody gets tested. All the employees, I get tested every day, get the questions asked. And, today, honestly, forgot my mask. Sorry. So they provided me with one to wear. But, the thing is too, one of the neat things about Shriners is that they have homemade ones. We call sewn with love, I think was the best way to put it.
Yeah.
They've been furiously working, all the volunteers who make a lot of other things that really help this hospital run. And they produced a lot of them. So there are some actual ones you can take home and use for a lot longer too.
I got one myself, and it's super fancy.
Love it. Absolutely love it. Love the
Gotta
bling.
have the sparkle. Well,
Absolutely.
Dr. Luhmann, we had a ton more questions, but I think we're close to running out of time. I just want to thank you for taking your time out of your busy schedule to do this for us and our patients and our families. And is there anything that you would like to add before we sign off?
Briefly, thank you, Tammy, for this opportunity. And I want to remind everybody that getting a patient into Shriners Hospital is extremely easy. It doesn't require any fancy referrals or anything else. What it calls, you can go on the website, you can find out, you can make a phone call to us, and that's all it takes to get an appointment scheduled to see us. We try to be very responsive, getting back as fast as we can to getting you to the exact expert that's going to give you the precise care that you and your child are really seeking. So thank you very much, Tammy.
Thank you. Well, that's all for us today at Shriners Hospitals for Children in St. Louis. We're so glad you joined us today. Like Dr. Luhmann said, if you'd like to make an appointment for your child to get the most amazing care anywhere, or if you'd like to make a contribution to support our Care for Kids, check the comment section of this video or find us on the web. Thank you very much for joining us today. Bye, everybody.
Thank you, Tammy. Thank you, everybody.
Thanks, Dr. Luhmann.